Because like it or not, even in the United Kingdom, you will have patients thinking that the fact they're paying you £3,000, £4,000 per implant, that's it, it's going to be there forever. And they will forget the fact that they bought a car for £20,000 and that car is not forever. So I think that sort of education needs to be there in the assessment visits to our patients that, yes, you're having an implant, but there will be lots of maintenance and review visits needed afterwards.
Just a flash question, Hassan. When a patient asks you, how long will my implant last? What do you say?
Well, that's a very good question, because obviously dentists are under pressure to say, my implant will last you for life, don't worry. But actually, you're worried because if you go to the patient and say, I cannot guarantee the implant, you're worried that this patient might go somewhere else. So the best way to do it is to go and say, and this is why I say, evidence-based studies, so basically it's not my theory, it's proper research, suggests that if implants are looked after really well, we can have a survival rate of 95% up to 15 years, maybe longer. Having said that, the same studies suggest that if you fail to keep the implants clean and if you get gum disease around your teeth and your implant going to fail within the first couple of years. So basically, I'm making it clear that we will do everything to make sure you get that long-term survival. However, it's a two-way equation. I need your help and your support to look after, by two brackets, your implant. And I think patients need to understand that. It's their problem. They came to us with a failing tooth. They came to us with a missing tooth. And we're doing our part. And I genuinely believe every dentist is going to be an honest dentist, trying their best to help their patient. But the patient needs to understand that they have a role in this long-term success should they want it to be there.
That's a really great point. And it's the same thing I talk about power function splints, The reason I color in my splints and then they grind it and then they see the markings is that so they can begin to own the problem. Because quite often they have no idea that it's there. And then when they see and then they own the problem. So just like that, they need to own their implant and own the problems that could happen with their implants because it's in their mouth, and they need to uphold the basic level of care and maintenance as well. So I'm sure that's drilled into them, excuse the pun, from the beginning, and that's part of the consent process. Hey, if you enjoyed this snippet from the Protrusive Dental Podcast, be sure to check out the full episode on www.protrusive.co.uk. It's also available on Apple Podcasts, Google Podcasts, Spotify, Amazon, you name it. It's everywhere. Also on YouTube. So check out the content. If you like it, please share it with a friend. Thank you.